As we celebrate Pride Month, it's important to look at some of the heavier issues impacting the LGBTQ plus community, and healthcare has some of the highest barriers. Good evening, I'm Elizabeth Cook. According to the latest study by the American Cancer Society, LGBTQ plus individuals experience discrimination and minority stress that may lead to elevated cancer risk. The study also showed that people in the LGBTQ plus population have a higher prevalence of smoking, obesity, and alcohol consumption, which can also raise the likelihood of cancer. The study concluded that health systems need to systematically increase awareness of the unique needs of this community to help mitigate that risk. But many health institutions are simply not informed or equipped to handle these needs. I spoke with one man who knows what it's like to be marginalized by medicine.
And then I just like to add a little razzle dazzle.
Ray Luna speaks to the world through music.
It's like coloring with sound.
Each note, each lyric is carefully curated to send a message about the person he wants the world to see.
I am feminine and masculine and more at the same time at any given time.
Ray started his transition 5 years ago when he was 27 years old, but his journey to this point started much earlier. Even as a young child, he knew typical gender stereotypes just didn't fit.
I felt uncomfortable, I felt ashamed, I felt embarrassed, and I'm just all around sad.
Ray had never heard the term gender dysphoria until a therapist suggested he do a little research, and something clicked.
And I was just mind blown. So I literally just cried and was happy. And then I was like, dang, but this looks like it's going to be hard.
The first challenge was finding the right medical team. Before then, he only went to the doctor when he was sick. He was in his early 20s when he had his first physical.
But if it wasn't for my transness, I don't think that I would have even started going to the doctor, because it's I only went to the doctor because I was I want to get those hormones that's going to make me happy.
But Ray's transition didn't start and end with hormones. He knew he still had to take care of all areas of his medical care, and that included getting a pap smear.
And I went and I had the doctor straight up turn me away. I kept experiencing stuff like that where people were just looking at me wild. I'm like, yeah, it says F, I'm a female. Yeah, that's what I was assigned at birth. Yep, that's my genitalia, but I'm not presenting as such. And it just felt like a lot of people were uncomfortable with it and having that prejudice.
Dr. Benji Leniakea is the chief of the Stanford LGBTQ plus adult clinical program.
We have to remember that until 2013, having a gender-affirming care was actually pathologized and had the diagnosis code of gender identity disorder. And until the 1970s, even just being gay was identified as a homosexual, disorder, right? Rather than recognizing these as distinct identities and communities that had distinct healthcare needs.
Dr. Leniakea, who goes by the pronouns they, them, says there are nuances to medical care for LGBTQ patients that often isn't covered in most medical schools.
Our patients might not necessarily have bodies that align with their legal sex or their sex assigned at birth even, right? And so making sure that we are able to do things like cancer screening appropriate for the body parts that are available, right? For instance, transmasculine individuals may have had top surgery, which means male chest reconstruction, to reduce chest tissue and to create a more masculine appearance, removing a lot of tissue that would normally have been screened for breast cancer. Now, not all of this tissue may be removed, right? So the nuance needs to be there in the appropriate screening afterwards. Conversely, our trans feminine patients who develop breast tissue often later in life compared to their cisgender peers will need breast cancer screening, but at an interval that may differ from their cisgender peers who develop breast tissue in puberty.
They make the curriculum for training future doctors like Melanie Ambler, who is in her 3rd year of medical school at Stanford.
This community has been marginalized within medicine, and the fact that I can be someone that can go into a room and attempt to gain back that trust and have the skills to do that is something that's really important for me, so that anyone that walks in the door feels comfortable with the person that they're speaking to, even if they don't share the same identity.
Ray eventually found his medical team that was able to provide the right gender-affirming care. But his transition is still a journey of discovering his true self. That's more than just a pronoun.
When I first found out that I was trans, I was like, I just want to be he, him. And so, but now I feel so much different because I've gotten the opportunity to let go of that and be like, oh, well, I'm actually not just he, him. I have been she. And if it wasn't for she, I wouldn't get to be he, they, them, z's, there. I use all the pronouns now.
A picture of Ray from the first grade hangs above his bed. A picture of a little girl who at the time was scared and confused. Who they were on the outside didn't always fit who they were on the inside. A little girl Ray doesn't want to forget.
You could talk to that little girl. What would you say to her?
I would say to her that we're right. That we're right where we need to be because we're going to get to be more than we can even dream of. Just never stop being real. You're a real one.
And we'll be bringing you stories like this all through the month of June. You'll be able to find them all on our website, kpix.com. Apple is tapping into the power